authorities in Guinea Monday confirmed a case of Marburg virus in the country. This marked the first time Marburg, a highly infectious disease that causes hemorrhagic fever, is being identified in West Africa. Marburg acts like the virus that causes Ebola and was detected less than 2 months after Guinea was declared Ebola-free. It is important to note that the Marburg virus disease is a highly virulent disease with case fatality rates between 24 to 88% in past outbreaks, depending on the virus strain and also the case management. The WHO said it has begun cross-border surveillance with neighboring countries put on alert. Joining me on Zoom tonight to look at the case of Guinea and narrow it down later to Ghana is Dr. Georges Kizerbo, the WHO representative in Guinea, and later will be joined by Dr. Dennis Lai, the head of disease surveillance at the Ghana Health Service. Let me start with you, Dr. Kizerbo. What is the specific situation of Guinea?
Good evening. Thank you for having me in your program. In Guinea, we have one case of Marburg virus disease confirmed by the health authorities, and the response operations are going on with around 150 active contacts being traced and actually under surveillance. So as you said, Guinea was in the 90 days active surveillance phase after the declaration of the end of the resurgence of Ebola this year. So the capacities on the ground were reoriented to take into account this new threat, which is a highly risky situation for Guinea, but not only for Guinea, for the neighboring countries also. So the situation is one case, no secondary case for the moment, but very high vigilance in the area.
I noticed you say one case, that is the death, and then about 150 people on surveillance. When you say there's no secondary case, does it mean that you have not identified any other person who has been confirmed positive with the virus?
As of today, no other case has been confirmed, but a number of high-risk contacts are being monitored, especially to see if they develop symptoms so that the testing can be done immediately and they can be referred to the case management facility. So one case confirmed so far.
Very well. How is this virus transmitted?
This virus is transmitted by contact with a person who is sick through blood or body fluids. It can also be transmitted through items such as clothes and other items. Sexual transmission has been documented in some previous outbreaks up to several weeks after discharge of patients. So it's mainly human-to-human transmission, but the source of infection is obviously in animals. In bats, it has been shown that it was circulating in bats in this region and other parts of Africa. And usually it's a breakthrough infection from animals to humans.
Okay. Is there any treatment if you are accidentally infected? Can you be treated?
Unfortunately, there is no proven treatment or vaccine. These are under research now, but there is no proven treatment or vaccine. The treatment is a supportive care. So depending on the symptoms that are presented by the patient, usually it begins like a fever and with malaise and like a flu-like disease in the beginning, or it can also mimic malaria. But after, at the phase of complications, you can have hemorrhagic symptoms. And this is a very severe phase with high fatality, as you said.
So how do you prevent yourself from being infected?
Prevention is based on universal precautions, mainly hygiene, individual and collective hygiene, hand washing, avoiding contact with people who are ill, and also avoiding, for example, reusing needles for injections. and also avoiding gatherings, especially at funerals, in this context where you don't know the cause of deaths. So funerals and people touching bodies can be a big factor in transmitting the infection. So it's important to sensitize the community, especially those who are in charge for burials and also healthcare workers also.
You mentioned the symptoms of the Marburg virus disease, which is flu-like symptoms, fever, and all of that. How do you manage a case? What goes into case management of a person infected with the virus?
Yes, case management would be symptomatic, depending on the symptoms. Giving antipyretics for the fever, and also especially rehydration, because it can also present with severe diarrhea and vomiting, which looks like cholera almost. So supportive care and vital care is very important. It's like intensive care, depending on the symptoms that are presented and the organ failures that can happen at the severe phase, complicated phase of the disease.
You mentioned cross-border surveillance as part of controlling the outbreak of this disease. Which countries are involved in this surveillance?
The area where the case was documented and diagnosed is very close to the borders to Sierra Leone and also to Liberia. So the three countries are working together. There were already cross-border meetings and coordination. And this is where we need to be very vigilant in terms of points of entry, checkpoints, and also looking at population mobility in these areas.
And so would the WHO, for instance, advise that the countries involved look at putting health systems at their borders? You mentioned the point of entry. So mainly the land borders, because of how interconnected countries within the sub-region are.
Exact preparedness, especially at border points, is very important. The health districts at the borders need to be on high alert, and I think this is already the case. They need to talk to each other, and they also need to protect the workers at the points of entry, be it health workers or immigration workers and so on.
Are you providing some sort of training for medical personnel in that country in Guinea? We know they have gone through Ebola. Just when we thought they're out of the woods, they are hit by this again. Is there some form of medical support being given to the country in order to deal with this?
Yes, WHO has deployed a surge capacity in different pillars of the response in terms of case management, infection prevention and control. We have the epidemiologists for contact tracing, so these disease detectives. We also have social anthropologists and communication experts who are engaging the community to get the buy-in and partnership with the community. This is very important.
Dr. Gizebo, kindly hold it for me. We're joined by the Ghana Health Service. In February this year, when the case was confirmed in Guinea, the Ghana Health Service asked all regional, district, and local health institutions to be on high alert. It also directed the regions and the district health facilities to initiate preparedness and some response plans of Ebola. Dr. Dennis Laye is the public health specialist and head of disease surveillance at the Ghana Health Service. Thank you very much for your time here on Join This Prime. Considering again how interconnected we are, what sort of response plans are you looking at the various units triggering in order to deal with this, the preparedness?
All right, thank you very much, and good evening to your listeners and viewers. I think my colleague from Guinea has highlighted a lot of the issues as far as surveillance in the sub-region is concerned. One of the things we do as the health wing of ECOWAS, which is the West African Health Organization, is having regular weekly meetings, what we call the Emergency Operations Center for the West African Health Region. And we do deliberate and share best practices and ideas, and also information on activities going on in our respective countries. So this is just part of it, and I think my colleague from Guinea has elaborated quite well on the things that we're doing. He mentioned cross-border activities, which is a critical component of our response in the West African region. One of the advantages we have currently is that our emergency operations or our emergency preparedness and response systems are already active. We are in the middle of an outbreak, COVID-19. And so this is just to add on to what we already have in place. And as he mentioned, a lot of the protective measures in place, they are just similar to COVID-19. So we're going to rehash these and also ensure that facilities are on high alert as far as this particular disease is concerned. So that I think will be my comment for now. Thank you.
And because you mentioned COVID-19, I mean, the health preparedness systems that we had for Ebola, those were the systems that were triggered to manage COVID-19, and there's a lot of focus on that. What is the assurance that should we have, and we're praying we don't have a situation, but should we have a situation on our hands, we have the men, the resources to deal with that, even as we have a pandemic on our hands at the moment?
Yeah, I mean, thank you very much. The honest truth is that we need to be able to do all we can, all that is within our power, to ensure that even if we should get a case, it doesn't spread. Because that's a key thing. No matter how prepared the health system is, it can be overwhelmed if numbers go above a certain threshold. And so that is what collectively as a country we should be working towards. And for us in the health sector, we are working with our various public health emergency management committees at the regional, at the district levels to ensure that we can be able to pick any case and then institute the appropriate measures, response appropriately. What we would also encourage the general public is that if people fall sick, if they've come up with any of the symptoms that my colleague has elaborated, let's report to a health facility. And whatever measures we are asked to adhere to, let's ensure that we do. It's a collective thing. It's not just about the health system. If we don't get the general public or the population to be behind us and adhere to the things we advise on, no matter what systems we put in place, it's not going to work. So it's a two-way thing, and I would encourage that we all understand what's going on, especially because we are in the middle of a pandemic. And as you rightly said, if we add on a Marburg to it, we're going to have issues. So it's important that people report to health facilities if they are not well, and then we can be able to do the appropriate investigations and response measures.
Thank you very much. That's Dr. Dennis Lai, Head of Disease Surveillance at the Ghana Health Service. We still have Dr. Gizebo on Zoom with us. Doc, even as we wrap up on this conversation, Guinea has been hit with Ebola, and just when they thought they were out of the woods, there's another disease. Obviously, the devastation will be strong. How is the WHO collaborating with government to provide logistical support and also intensify education because of some fatigue that may set in among the citizens?
Yes, thank you. WHO has a hub in Zerekore, which is the regional capital of the southeastern Guinea region where this is happening. We also sent in Guekedu, near the hotspot, a search capacity team to work with district health authorities. We are providing logistics support, especially for infection prevention and control, protective equipment for health workers, but also for community health workers who are working with the communities. We are working with other partners, UN agencies, multilateral, bilateral partners, international banks, to support the national response plan. And as my colleague from Ghana was saying, we are taking into account the regional dimension with the Mano River countries, the 6 countries bordering Guinea, and also West African Health Organization.
We're grateful for your time. That's Dr. Georges Gizebo, the WHO representative in Guinea, bringing us some details on the Marburg disease that had been recorded in Guinea. We also spoke earlier to Dr. Dennis Lai, who is a public health specialist and the head of disease surveillance at the Ghana Health Service. You're watching Joy News Prime with me, Ernest.